Hello, my name is Dr. Nicholas Volpe. I'm the chairman of the Department of Ophthalmology here at Northwestern Medicine, and today we're going to take you inside the operating room to see adult strabismus or eye muscle surgery with adjustable sutures. Our patient today has a misalignment of her eyes that is causing her to see double. The way we manage this is by isolating the eye muscles and repositioning them. The procedure will take about 90 minutes. The patient will go home with a patch on one eye and will have minimal pain. Now, come with me inside the operating room. We've got an expert anesthesia team that has our patient now asleep under general anesthesia. Contrary to what some people might think, we can't actually take an eye out and put it back in to operate on it, so all the surgery is done by leaving it exactly where it is. In this case, the surgery is being done on the inferior rectus, which is down here, and the medial rectus, which is here. So we're going to make a single incision that allows us to get access to that. So you see now we can kind of get under the surface of the eye. There's actually another layer called Tenon's capsule. It's sort of this stringy, stretchy stuff here, and we're just going to kind of open that up very carefully, creating a space for us to isolate the eye muscles. So this muscle, because the eyes are too crossed in, we're going to make it weaker. You see it traditionally pulls from this point about 5 millimeters from the colored part of the eye or the limbus. We're going to move it back so it's pulling from maybe 9 or 10 millimeters. So in order to move it, we have to take it off the eye. And to take it off the eye, you can't take it off without putting a suture in it, because if you were to cut it now, it would sort of retract back into the eye socket and we wouldn't be easily able to retrieve it. You can imagine this has to be very precise. And one of our ways of getting around that is we leave the operation unfinished. The muscle's on a pulley, and I'll be able to adjust that tomorrow morning with the patient awake and cooperating with me, so that she can then tell me where the position of the images are and whether she's seeing single. The experience of seeing double is incredibly disabling, and if your only choice is to either wear a patch or close your eye, you can imagine having surgery to fix that double vision can be life-altering. It is indeed incredibly fulfilling as a profession to be able to help people with this condition that makes them feel very vulnerable. It's far from a cosmetic issue. Making somebody's eyes look straight can be a big confidence and life booster. So now we're just going to put that second traction suture in to position this muscle to be adjusted tomorrow. Then we'll close up that covering of the eye muscles, the conjunctival layer. Then the right eye will be complete, and in the left eye we're going to do it slightly differently. We're not going to make it adjustable. So in fact, both eyes are not ever crossed. One eye is always the point that is looking at whatever the patient's trying to look at, and the other one is crossed in relation to it. So these surgeries are designed to change the angle between the two eyes. And it's hard to say without waking up and seeing. The eyes look nicely aligned, and we'll have the ability to alter it tomorrow. So I think we've been able to help her a lot. Our procedure went really well today. The patient has a patch on one eye and she's heading to the post-operative area. She'll then go home and have minimal discomfort. Tomorrow morning she'll come back up in the office in the clinic. We'll make any final adjustments that might be necessary to ensure that the eyes are aligned and tie off all the sutures. And then at that point, we'll have eliminated all of her double vision. Thank you for joining me inside the OR.